Hello, everyone. I'm Dr. Marty Ross, and we're having another conversation with Marty Ross MD tonight. As you know, this is a webinar where we're going to talk about Lyme disease, and what we talk about is based on your questions. So I am very interested, as usual, to see what you have in store. We seem to have a smaller turnout tonight. That may have to do with the fact I didn't send out the email letting everyone know that we were holding it until this morning. So we'll see what happens. But that does mean that those of you that are here may actually get your questions answered if you ask it of me as well, too. So there's two ways you could participate. Number one, you can write a question to me. And the way that you do that is there is a chat box on the lower, I think, right-hand side of your computer screen. And there's two options you have there. One, you'll see there's an icon that looks like there's two windows chatting together. And there's another one that is a question mark. Don't use the question mark one. Use the one that looks like the two windows chatting together with each other, okay? And then when you write your question, the thing I ask is that you don't hit the enter key until the whole question is complete. If you try to use the enter key to create paragraphs, what it does is it literally sends separate questions my direction. And if it's part of the same question, that gets very hard for me to sort on this side of my screen. The second way that you can participate is to actually see what questions others has and see what kind of responses that I give to those questions too. And so there's a lot of learning that can happen with that. And as you'll see, as we get into this, I tend to describe a lot of things. And so one question opens the door for me to talk about a number of things. So I'm glad to see that you all are here tonight. I am creating a recording of tonight's webinar as usual, and sometime tomorrow morning, usually around 9:30 a.m. Central Standard Time here in Austin, Texas, I send out an email that includes a summary of what we talked about, as well as a link to the recording. Also, in that email tomorrow morning, you'll have the option to sign up for next week's webinar. So we do have a full webinar next week as well, too. All right. And so that takes care of the background information I have here. Let's go and get started here. Hello, Molly. Let's see. Hi, Dr. Ross. I had a tick bite hello and welcome here too, by the way. I had a tick bite a few years ago, but didn't have any symptoms. About a year ago, I started having arthritis pain. I was diagnosed with Lyme, Bart, and Babesia. I have been following your protocol of antibiotics and supplements for 7 months. I'm slowly starting to get better about a month ago. I can finally walk and do stairs, and the ankle swelling has gotten much better. But I still have pain in my arms and feet. I have to take an Aleve and Tylenol arthritis, and I'm taking liposomal curcumin every day. I just met with my doctor, and she wants to start me on low-dose naltrexone to help with persisting pain. I see you have a protocol that next adds BPC 157. How long do you recommend before starting BPC 157? Thanks. All right. Good questions. So first of all, there's a comment. So it's not uncommon that people will get a tick bite and initially have no manifestations, but it's down the road that they do start having problems. And probably what happens initially is the immune system is able to actually keep the germ under control. It may not get rid of it. Sometimes it can get rid of it on its own without even using antibiotics, but sometimes it doesn't. And so down the road, as Lyme gets a hold in there, it can sometimes lead to immune suppression, which allows the germs to get more active, or sometimes our lives get in the way. And the stresses of our lives can lead to suppression of the immune system, which then allows the germs to get more active. Okay, so just be aware of that. That's not an uncommon thing to have happen, basically. And we actually don't have any studies that tell us how effective the immune system is at dealing with this thing on its own. Not everyone that gets a tick bite that gets transmission of germs needs to be on antibiotics. It is very possible that the immune system can knock the germ out. It's possible that the immune system may also just put the germ under control and we cohabitate with it. But if an event happens that suppresses the immune system, then the germs can get more active. And one of the more common things that suppress the immune system is just those stresses we have in life. Those can be big immune system suppressors. And in addition, sometimes the Lyme germ, if it can sometimes work around the immune system and get more active on its own as well, too. Okay. All right. Then in terms of how quickly people turn around, It takes time. So if we look at studies about how quickly the people will improve for just the Lyme germ, the Borrelia infection, what studies tell us is that by 3 months, about 30% of people start having some improvement with treatment. By 6 months, 60% of people start having improvement with treatment. And by 9 months, 90% of people have improvement with treatment. Okay, so it just takes time. On the other hand, for Bartonella and Babesia, those germs can respond more quickly. And part of the reason is those two infections replicate more quickly than what the Lyme infection does. So Lyme reproduces itself about every week to every month or so. It's very slow growing, okay? And things that are slow growing take longer time to kill, basically. Versus Babesia and Bartonella usually replicate daily, and so they'll be more responsive to the antibiotics. In terms of Bartonella and Babesia, about 85% of people can get well with standard treatments. And a typical course for Babesia is going to be about 4 to 5 months of antibiotics. And a standard course for Bartonella is going to be about 4 to 6 months. Okay. Now, if you're online and you're here maybe because you're having a hard time getting treated. But I want to let you know the majority of people, 85% of people, will get over Bartonella and will get over Babesia. Not everyone goes on to get chronic infections with those, okay? And so a typical course, when your Bartonella or your Babesia treatment is working, you'll start seeing a lifting of those specific symptoms that we relate to those infections, usually by 1 to 2 months. And if you're not starting to see some improvement in those Bartonella symptoms or Babesia symptoms by 1 to 2 months, then you want to change your antibiotic protocol, herbal or prescription, to something different to see if it will work better for you, okay? And so in terms of symptoms that will follow to see if your Bart treatment is working, I'm going to look at a common symptom people have with Bartonella often is anxiety is part of that. Sometimes pain on the bottom of the feet, sometimes tremors, sometimes severe cognitive issues. And so I want to follow those and see if we start improving somewhere in the 1 to 2 month range. Okay. And then Babesia symptoms can be night sweats, can be feelings of air hunger, like you can't get enough air. Sometimes that'll be part of Bartonella too. Babesia sometimes can give a lot of headaches. Babesia sometimes can cause a lot of dysregulation of your blood pressure control. So when you stand up, you get lightheaded easily, okay? So just follow those symptoms and see, do people start getting better by 1 to 2 months? And if they don't, I want to change a Bart treatment protocol, or I want to change a Babesia treatment protocol, okay? Borrelia, on the other hand, sometimes you just don't make any changes. It's just a matter of staying on those same herbal antibiotics or prescription antibiotics and giving it time, because it's going to take a lot longer for Borrelia to turn the corner. All right. So I'm glad things are getting better for you. That's good. And so one of the ways of getting your pain and inflammation under control is to keep knocking your germs down. Okay. Because those germs are triggering your white blood cells to manufacture too many inflammation chemicals called cytokines. And it's cytokines that give you most of what we call Lyme disease and Bartonella and Babesia symptoms, of which one of those big things they cause is inflammation. All right. So keep working on your infections. I like that you're doing the liposomal curcumin. It is a supplement that can get inside white blood cells and block cytokine production. If that is not enough, another frontline treatment that I will do before going to a low dose naltrexone or going to a BPC 157 is you might consider adding in liposomal glutathione. Okay, so curcumin works by getting inside your white blood cells and interrupting the factory production line for cytokines. Okay, what glutathione does, which is different, is it is a very powerful antioxidant. It's made in every one of our cells. Its job in our cells is to repair injury. Okay, but as a powerful antioxidant, it actually lowers oxidizing agents that tell white blood cells to make cytokines. So it acts to block the order, the message going to white blood cells that tells them to make cytokines. So you get an added effect. You've got curcumin on the inside of the white blood cell saying stop, and then you've got glutathione on the outside interrupting the message telling the white blood cells. All right. So a simple thing you might consider adding would be liposomal glutathione. Usually 1 teaspoon a day of a product by Research Nutritionals called Trifortify is what I like to use. And you get about, I think it's 550 milligrams of glutathione with that product. The reason I like their product is they've got good data showing that they get great absorption. And that is the problem with most glutathione is it's hard to get it absorbed. But this liposomal preparation, this fat, where they take fat and mix it in with their glutathione, it actually has increased the absorption of the glutathione. So I like that. Okay. And their product, again, is called Trifortify. All right. So when lowering germs and being on curcumin and glutathione don't work, then the next step is that I like to do is exactly what your healthcare provider did here, which is to look at that low dose naltrexone. All right. So naltrexone, everyone, is used for people with addiction issues of alcohol and even narcotics. And it actually binds to our narcotic receptors, which are also called endorphin receptors. Our bodies have a natural endorphin system, our natural pain medicines we make for ourselves are called endorphins. And those endorphins not only regulate pain, they regulate our immune system. If you provide a blockade of the endorphin receptors in the body, that leads to, over time, a softening, a downregulation of inflammation, okay? And it can take a good 6 months to get a full effect of low-dose naltrexone, all right? So that's one thing you could do. And if you have started that and you have not waited 6 months, then, it just may take more time. The other thing you can do is work with the BPC 157. So BPC 157 is a peptide. Peptides are basically built, or not basically, they actually are. They're made up of amino acids that are put together. So amino acids are the building blocks of peptides. They're also the building blocks of proteins. The thing that makes a protein different than a peptide is how many amino acids do you put together, all right? If you have 40 or over 40 amino acids, we call that a protein. If you have less than 40 amino acids, we call that a peptide. We recognize that in the human body, we now are aware of over 100 different peptides that we make naturally, of which there is a peptide called BPC 157 that is made in the stomach lining that has a whole host of benefits. I mean, it can help blood vessels regrow. It can repair injury to tissues and joints and muscles. It can repair nerve tissue injury. It can help your intestinal cells work better. It can help improve intestinal function as well, too, which is the main reason it's made in the stomach, and that's the main reason the stomach makes it, okay? It has the ability to regulate levels of what are known as Th1 and Th2 inflammation. So let me talk about that. And I'll tell you in a minute what LDN does with those two. All right. So there's a type of white blood cell called Th1 cells. And there's another type of white blood cell pathway of inflammation called Th2. Th1 is made up of your cells that attack germs. All right. Th2 is made up of your immune cells that make antibodies. It's made up of your allergy cells, and it's also made up of cells that are, those would be the predominant things, okay? All right. So when you get infections, sometimes you get an imbalance where you'll start getting too much allergy type symptoms going on, or you might sometimes get too much Th1 inflammation going on, and these two regulate each other. BPC 157 works directly to tell Th1 to come down. And if that comes down, then that's going to lead to less cytokines, all right? Low-dose naltrexone, on the other hand, works at a different level. Low-dose naltrexone works at a type of cell called a T regulatory cell. And T regulatory cells determine the actual balance of Th1 and Th2. It's kind of like the parent in the room. It's the parent that screams at the kids to say, behave yourself, all right? So LDN raises Tregs, which then have the effect of balancing Th1 and Th2, versus BPC 157 goes right at the Th1 level to kind of help bring that down, that inflammation down, okay? And it can be a nice complement to your low-dose naltrexone. So you could start like a low-dose naltrexone, wait a month or two and see what happens. And if you're not getting much benefit, then add in a BPC 157. The reason I don't jump for BPC 157 right away is it's expensive. I mean, it's $140 a bottle, and that allows you to take one pill twice a day. So I kind of keep it in my back pocket in case some other things aren't working, basically, all right? All right. So anyhow, my approach to inflammation: get germs under control, work with curcumin to block the white blood cell production, and then work with glutathione to block the oxidation orders that get to those white blood cells. If that doesn't work, come back and work with low-dose naltrexone, which can be useful at raising T regulatory control of Th1 and Th2 inflammation. And if that's not enough, then come back and add in some BPC 157 that can go right to the Th1 directly and kind of turn that down a little bit. Okay? All right. It's a lot of complicated stuff. I hope you followed that. Good luck to you. Let me just do a quick screen share here for people that want some more information here. All right, so this is my store, and earlier I was talking about the product called Trifortify, and there's a number of different Trifortify products. Basically, it's all the same stuff that's in the tube. It's just you got larger tube, smaller tube, and you have different flavors, and even comes in single dose serving packets, if you will. Okay, so that's that product. What I like using for curcumin is called curcumin phytosome, and it's by Research Nutrition, or I'm sorry, by Thorne. So that's the product we were just talking about there. Okay. And then if you are interested in peptides, the company that I carry that does a number of peptides is a company called Integrative Peptides. And we carry their whole line. I've got a couple new products from them that I got to put up here still, but this is the BPC 157 that we were just talking about. Okay, and so that's a place that you can see it as well too. All right, now, anyway, just so you know, my store is made up of products that I used with my patients when I practiced in Seattle. I stopped clinical practice in May, but I still maintain May a year ago, that is, but I still maintain this store, and this store is for anyone. Okay. The main thing I want to let you know is that I've tried probably 99% of these products with my patients, so I have some idea if they work. I also do a good job of picking quality products, so you don't have to take, so I take the guesswork out of that for you. Advantages of ordering from my store is, number one, I offer the lowest prices the manufacturer allows. Number two, I offer free shipping if you have orders over $50. And number three, I cover all of your taxes if you have taxes. And then finally, we ship fast. My fulfillment center here in Austin, Texas, will move orders to the U.S. Postal Service for all orders that come in before 2 p.m. Monday to Friday. We will move them the same day to U.S. Postal Service. Things that come in over the weekend will move on Monday. Okay, but that's pretty quick. All right. So anyhow, there you go. All right. One other thing I wanted to show you. For those of you that want more information about low-dose naltrexone, there is a whole article I have on that. And then finally, if you want more information about the various peptides and what they can do for you, and these are oral peptides. I focus on oral peptides. I think the market for IV and injectable peptides is going to get shut down by the Food and Drug Administration soon here. Okay. So anyhow, take a look at my peptide article here where I walk through the various options, including BPC 157 right here. Okay. All right. Good luck to you, Molly. Let's see here. Hello, Eileen. Let's see. Thanks, Dr. Ross, for all you do. You're welcome. A friend was diagnosed with Lyme several years ago, treated with Doxy, works in a large office building with some mold issues. What would cause a body odor on some days? Appreciate your help and input. It's interesting. So when we look at how things that are fat soluble get detoxed out of us, or fat toxins, fat soluble, fat based toxins get removed from us, there's a couple ways. Okay. Number one, if you things that are fat soluble that are toxins get moved by the bloodstream down to the liver. And in the liver, they are transformed from a fat-soluble substance to fat-soluble to a water-soluble substance. And the way the liver does that, it's a bunch of chemical reactions. And at the end of these chemical reactions, it slaps a water-soluble chemical on these fat toxins. It makes it water-soluble, okay? And then those water-soluble toxins get moved out into down to the gallbladder and then out into the intestines. And because they're water soluble, they mix in our poop and we poop them out. All right. So they don't bother us. Okay. Now, the other way that we can get toxins out, if our liver is not able to remove these toxins adequately, another way that toxins will come out is through our sweat. All right. And, like if you probably hear people getting sauna treatments as part of detox, right? So what happens when you get a sauna treatment is it heats you up, and all that heat causes toxins that are in you to move into your bloodstream. And of those toxins that get moved into your bloodstream, if about probably 80-90% go to the liver transforms them into a water-based toxin, but the remaining toxins come out in your sweat. Now, if the liver is overloaded with toxins, or if the liver for some reason is not able to break those toxins down, the only other way they can come out of you is through sweating. And so you will see sometimes people that have toxin overload, either from environmental fat-based toxins or from mold toxins. If their liver is having a harder day, or if they're not pooping out enough to remove those toxins, then sometimes they're going to start building up more, and then it's going to come out in the sweat. All right. So that may be what's happened. I can't diagnose your friend, obviously, but that would make me wonder about that, basically. Okay. So the other thing I just want to talk about briefly is mold toxins are actually not handled well by the liver. So mold toxins, which are fat-soluble toxins, go to the liver. The liver can't transform them. And then they then get moved into the gallbladder, still as a fat-based toxin. And then they go out into the intestines, and out in the intestines, they can get reabsorbed back into the bloodstream. Okay, so that's if it is a person that is not able to break down mold toxins the way 90 or 75% of us. Okay, so 75% of people, what happens when we breathe in a mold toxin from the world around us, it gets into our bloodstream, and some of our immune cells will see that. Those toxins and break them down. So the front line that works in 75% of people is the immune system breaks the toxins down, and the liver never has to detox them. Okay. But 25% of people have a genetic abnormality where the immune system does not work correctly to break those mold toxins down. They then go to the liver cannot transform them, and they then get moved out into the gallbladder, out into the intestines, and they get reabsorbed again. All right. So not everyone that walks through a building full of mold toxin cloud will ever have problems with mold toxicity, because 75% of us, our immune systems will just break this stuff down. But there are 25% of people that cannot do it. Okay. And so if your friend happens to be one of those people, the other thing your friend should be doing is being on something to grab hold of those mold toxins in the intestines so they can't be reabsorbed again. And if he could start binding up those mold toxins in the intestines, that's going to leave less of those toxins getting absorbed back into the bloodstream. So there will be less toxins to be sweated out, basically. All right. So you may be familiar with mold toxicity and the binders and things we can use. But if not, let me just do a quick screen share. And this may be something you share with your friend as well, too. Let's see here. All right, so if you can find my article on mold toxicity in the detoxification section here, and then click on my mold toxin illness and Lyme disease. Okay. All right. All right. Good luck, Eileen. Good luck to your friend. Hello, Rob. Let's see, Dr. Ross. I'm experiencing these roving body muscle aches that seem to come and go and in different parts of the body, sometimes almost like tendinitis. The really strange thing is that they are much worse in the morning, and by late PM, they almost go away. I just can't grasp how that can be. Any ideas or suggestions? All right. So there is a quality to Borrelia, not Bartonella, not Babesia, not Ehrlichia, not Anaplasma. So I just listed out most of the tick-borne infections there. Okay, but the tick-borne infection called Borrelia, which we also call Lyme, there is a quality that is unique to it, and that is it produces wandering pain and wandering neuropathy. All right. And many of you may be familiar with Dr. Richard Horowitz, who has a screening questionnaire you can do to see if you might have Lyme disease. He has looked at the accuracy of that screening test, and what he found in some of his studies is that the quality of wandering nerve pain or nerve syndromes, or muscle pain, muscle syndromes, or joint pain and joint syndromes, the wandering quality, if you have that, it is as good as a blood test for diagnosing Lyme disease. And it is as accurate as a positive Lyme test. Okay. All right. So just be aware it's coming out of your Borrelia infection. All right. So the one thing that you need to do is obviously be killing your germs. Number two, you want to be trying to control the inflammation chemicals that your immune system is making to attack those. And I talked about those earlier, but you want to be on curcumin. And you also want to be looking at glutathione to help with that too. All right. And if those are not working well enough, then you may want to start looking at a low dose naltrexone or a BPC 157 that I talked about earlier here too. Okay. All right. The other thing is if these are primarily muscle pains, sometimes working with magnesium can be helpful. Most of us, and this is anyone, healthy people as well, people that don't have tick-borne infections, most people are magnesium deficient these days. And it's a result of our food sources they're being grown in depleted soils, basically. And one of the first things that can really help decrease muscle cramping and even joint pain sometimes, and headaches especially, is magnesium, right? And the magnesium that I prefer these days is something called magnesium glycinate. That's Glycinate. There's different forms of magnesium. There's magnesium carbonate, there's magnesium malate, there's magnesium glycinate. Of the magnesiums, the glycinate salt form tends to have less intestinal irritation, right? Because what happens with your carbonates and your magnesium sulfates and your magnesium malates is there's an increased chance of getting loose stools. That tends not to happen as much with the glycinate form. The glycinate may do better brain penetration as well too, okay? But you can take anywhere from up to about 300, 600 milligrams a day of the glycinate. I would do that before bedtime. Even though I said it probably won't give you a lot of loose stools, you still... if it does give you loose stools, you back down on the amount. The reason I suggest that people take it near bedtime is that it can make you sleepy. So it can help with some sleep issues if you have that as well too. So consider magnesium as well too. Okay. All right. Good luck to you. Hello, Lauren. Let's see. Hi, Dr. Ross. We discovered that we had mold in our HVAC system and in our basement. My 16-year-old son has had neurologic symptoms for a year that led us to discover the mold. And now after doing IGenics and real-time labs and mosaic oat testing, he has IgG for Burgdorferi, high levels of all the molds on real-time labs, and C. diff and Clostridia on the oat test. His labs show all the markers of chronic inflammatory response syndrome, and I'm convinced he also has Bartonella based on his major symptom, which is horrible OCD. He has not been in school for 3 months and has what he describes as social anxiety. He is also MTHFR, and we all are. We've been working with a specialist that is of the mindset to go slow because of the mold. It has been a few months now, and he is not getting any relief at all. We just stepped up his treatment and increased and added meds. He is currently taking azithromycin, minocycline, low-dose naltrexone, liver support, glutathione, curcumin, interferase enzyme, biacillin, NAC2700, and more. Okay, so Lauren, let me. Oh, I think you may have. Oh, there's a second part here. Let me see if I can find that here. Let's see. Also started amantadine was on 5 milliliter increase to 10 milliliters of ibuprofen. And I think you even have more here. No, that's it. Okay. So, Lauren, I want to give you something to think about. So one of the things that, so if he's not getting it, from what you've written here, I don't see any treatments for the mold toxicity. I don't see any binders here. All right. I do see that he's on antibiotics that can take care of Bartonella, can take care of Lyme, that LDN can help with inflammation. Glutathione can help support general detox, but again, it's not going to do anything to help remove mold toxins. The mold toxins aren't processed by the liver, and the glutathione would be helping with liver detox and also lowering cytokines as well too. The enzymes aren't going to necessarily do it. The NAC is not going to get it. He needs to be on a binder, okay? Things that are going to bind up those mold toxins, all right? So I want to share a story with you that may have you relook at this a little bit. So about, probably about 7, 8 years ago now. And what I'm about ready to tell you, I have numerous stories similar to this, but I'll just share one person's story. So I had a gentleman that was brought in by his mom. His mom was a nurse. They had been seeing a naturopathic doctor in Seattle that had diagnosed this person with Lyme disease and had suggested that because his thinking was so horrible and that she wasn't having any success with antibiotics with him, that he needed to fly pretty immediately out to Washington, D.C. to start intravenous antibiotics with Dr. Jemsek. Jemsek was just recently had to stop his practice, but was doing a pretty aggressive IV protocol for patients at that time. And, you know, when he came to see me, he had positive Lyme tests. I mean, he had clear evidence of laboratory infection or immune reaction to the Lyme. Okay. So keep in mind these tests that you probably have had done. You didn't tell me which lab they were, but the testing that you've had done so far usually is looking at immune reaction to the infections, but the immune reaction does not tell you if the immune system got rid of the infection or not, or even has it under control. Okay. All right. So when I started visiting with my patient, I just said, and this is what I do with everyone, I just say, tell me your story. You know, what happened? And by the way, this guy had lost his job. He lost his wife. He lost his kids because he couldn't do anything for them. And it was really pretty bad. And his mom brought him in just because there was no one else in his family to help him, basically. So anyhow, bottom line is, as I was asking about his story, I said, so when did you first get sick? And he told me, and I said, anything change around that time? And did you move into a new house? Did you happen to start a new job in a new building? And he goes, yeah, we just moved into a new house. And I said, well, tell me about that house. And so he started telling me about it. And as he's telling the story, he goes, yeah, by the way, there was this back bedroom there that we discovered had a bunch of black mold on the wall. And they used to keep the aquarium there. And I said, is that when you got sick? Was when you, like, weeks or maybe a month or so after you moved in that house? He goes, yep. So I said, I'm not convinced this is Lyme. I know you have a positive Lyme test, but again, the test doesn't tell me whether the infection is still in you causing a problem, because your immune system could have dealt with the infection. Okay. And so we did real time. I didn't do Mosaic at that time. And it came back, he was loaded with toxins across the board, every major family. And all that I did with him, I chose, and I've done this with numbers of other patients too. I just did not do anything for his tick-borne infections. I went down the pathway of putting him on binders and supporting him to be able to remove those mold toxins. So one thing I'm wondering, and I don't have the advantage of being able to ask the whole story here, but if you've been on antibiotics as you have been and you're making no headway, you may want to rethink about whether maybe this is mainly a mold toxin illness situation, and either work with your provider to stop antibiotics, backtrack. I said work with your provider. I didn't tell you to stop without talking to your provider, okay? Because I have to be careful here. I'm not your doctor. I'm not his doctor, okay? But consider stopping antibiotics, backtracking, and start on a program of binders. Because if it's mold toxicity, sometimes within 3 to 6 months, you can turn it all around. And with my one patient, within 3 months of binders, he was 50% well. With 6 months of binders, he was 100% well. And we never had to do anything to treat his tick-borne infections because it was a red herring. He did have positive tests, but again, those tests are immune reaction tests. It doesn't tell you if the germs are still in you, okay? So I would go back and talk with from what you said here, and I wish I could ask a bunch of questions to clarify this, but the only thing I'm going to point out here is it may not be about the antibiotics. It may have nothing to do with it. It may have to do with mold toxicity. And you might pull back, go after mold toxicity. It is also okay if your provider thinks, wow, I really think this is still infection and there's mold toxicity here, then you need to probably encourage, if you're making no headway, encourage the provider to start on some binders to start pulling those mold toxins out, okay? So the reason these can all look the same, and mold toxicity can give this full picture you just described here. It can give everything that you've just described there, okay? The reason that tick-borne infections and mold toxicity looks the same is that both of them trigger your immune system to make too many cytokines, okay? And it's too many cytokines that give you the mental health issues, disturb your sleep, make you hurt all over, make it so you can't think, interfere with how your hormonal systems work, et cetera, et cetera. It's increased cytokines that are the problem. So I would encourage you to look back with your provider to see if they might support you and maybe just going after mold toxicity by itself, or at least doing antibiotics and mold toxicity treatment at the same time. Okay? All right. Good luck to you, Lauren. Good luck to your son. Hello, Bob. Let's see. I've tested positive and diagnosed with Babesia. Oh, wait a minute. I got to go back here for a minute. One thing, Bob, before we answer your question, for the last person I was just talking to about your son with mold toxicity, one other thing I want to say. I know the OAT test says that your son might have C. difficile. I want to caution you to be careful about doing something about that, okay? We all have C. difficile in us. It's a normal bacteria that lives in our intestines. When it becomes a problem is if it grows too much and starts releasing toxins that give us diarrhea, all right? So it's normal to find organic acids, or even if you do a stool test to find C. difficile in you. The problem is if it overgrows relatively to how much is supposed to be there, starts releasing toxins that then lead to diarrhea, okay? So we got to be careful. I guess the main thing I would say based on your son's situation is don't treat a test, treat the person. So if your son looks like he's got C. diff showing up on an OAT test but has no diarrhea, it's probably not a problem, okay? And just because you have a positive Borrelia, Bart, Babesia test does not mean they're the problem. They could be, but we got to be careful to make sure it isn't something else. Okay? All right. Good luck again. All right. Bob, let me go back to you again here. Hello, Bob. Let's see. I've tested positive and diagnosed with Babesia coli and have chosen the cryptolepis artemisinin treatment path to begin with. Right now, I am up to 200 milligrams of artemisinin twice daily for 3 days every 2 weeks. I am trying to increase the dosage, but I'm finding that after 3 days on, about 2 days later, I get some serious vertigo issues. Any suggestions or thoughts? By the way, dealing with a nasty case of anemia, so trying to treat with things that are non-hemotoxic or low hemotoxic. Okay. So, Bob, a couple thoughts, okay? Number one, I want you to be aware that in some people, Babesia can lead to breakage of your red blood cells, and then you get anemia from that. So your doctors should be doing some testing to make sure you're not getting hemolysis. They may have done this, but you're not getting hemolysis or breakage of your red blood cells leading to the anemia, in which case that is from the Babesia. And you might want to be more aggressive than doing herbs if your Babesia is leading to anemia because it's rupturing the red blood cells. The Babesia is, okay. Now, it's a rare person that gets anemia from Babesia, but it can happen, okay. So I just want to throw that out there as a cautionary note, okay. All right. Regarding the artemisinin, as many of you may be familiar, it is one of the herbs you can use for Babesia. I like to do a very high dose of it for 3 days on, then take 11 days off. The reason I do that is that the liver develops enzymes that can detoxify the artemisinin, making it so it's not useful. So you can use it for a few days before the liver turns on. So you use it in high doses, let the liver calm down then, and you go back again and do it in another 2 weeks, basically. All right. All right. So in terms of artemisinin, what you'll see sometimes in using it is that on the days that you're on it, sometimes people tolerate it well, and it's not till day 4 or 5 that you start either see or that you see some effects of it. Right. So a Babesia Herxheimer or killing reaction from killing Babesia can lead to more air hunger, more sweats, or sometimes a feeling of imbalance, okay? Kind of an imbalance where you feel like you need to hold on to the wall as you walk. If that is happening on day 5 and then goes away pretty quickly, it may be a killing reaction. It could be, okay? Because you can see killing reactions even up to 2 days after you stop your artemisinin dose, okay? On the other hand, unfortunately, it could be a side effect, all right? But I got to tell you, the fact that it's happening on the 5th day says to me that fits more with what I see with a Herx reaction, all right? So I would talk it over with your physician, see what they think too, but it maybe you just stay at that dose because you're maybe triggering quite a Herx. And as time goes on here, over time, you'll start having less and less of a Herx. So maybe after 2 or 3 more rounds, you should start seeing that that dizziness go away if it's part of a Herx reaction because you have less germs that you're killing each time, okay? And once it does go away, then feel free to start advancing the dose again, all right? That's just a thought, all right? I don't get to ask you a bunch of questions to clarify really I'm right about that, but I just want to make you aware. A Babesia Herx can give you symptoms of air hunger, sweating, great fatigue, and sometimes dizziness or an imbalance that makes it that will show up on day 4 and day 5 from when you first started your artemisinin. Okay, all right. Good luck to you, Bob. Hello, Maria. Let's see. Hi, Dr. Ross. My question, can chronic Lyme cause arthritis? And if so, how to fix the joints? I have a problem with jaw, neck, can't open my mouth. TMJ doesn't work. Physicians don't want to know about Lyme, and I have to treat myself. Don't know where to start, so joints don't go bad. Okay. So Lyme can give arthritis in various joints, and it's due to infection in the joints leading to inflammation. Okay. But I have to caution you that unless you have other symptoms of Lyme, you need to work with rheumatologists to find possible other causes of your arthritis, okay? So not all arthritis is due to Lyme, all right? So if you have other symptoms suggesting Lyme, then I think it's okay to treat for it. But if all you have is inflammation and pain in the joints without any other symptoms of Lyme, then you need to start looking for rheumatologic causes other than Lyme. All right. So symptoms that could suggest Lyme, sleep disturbances, brain fog and cognitive difficulty or thinking problems, fatigue, muscle pains, joint pains, neurologic dysfunction with numbness or inability to move a joint like a finger or a limb like a finger because you've got neuropathy, okay? So if you've got any of those other symptoms, then I think it's okay to say maybe it is Borrelia. But if not, you need a rheumatologist to evaluate and make sure it isn't something rheumatologic going on other than Borrelia, okay? All right. So one thing you may have noticed, everyone, that I've kind of been describing tonight is we can't always just put our Lyme blinders on and think that everything is Lyme, because people, it may not be Lyme, it may be something else. And one of the jobs that I had, when I was treating people clinically, was to go in, sit with them, and try to figure out, yeah, you got a positive Lyme test, but what else could this be? All right. Because sometimes it is not Borrelia giving you all those problems. It is something else. And just having a positive Lyme test does not prove the infection is causing the problem. It's a clue, but doesn't prove it. Okay. All right. Hello, Mindy. Let's see. Dr. Ross, do you have an opinion about tefenoquine, the anti-malaria drug that's supposedly effective against babesiosis? Thank you. Yeah. So the newest kid on the block is tefenoquine. All right. And tefenoquine comes from a family called the quinolines, of which there are two we can actually use in Babesia treatment. One is a much older drug called primaquine, and then the more recently there is tefenoquine. Tefenoquine has got some good laboratory evidence showing that it is quite effective against Babesia microti. Okay, so one of the strains of Babesia. There is, I'm trying to remember, there was actually a, I think mice studies that were done looking at tefenoquine, and what they were able to show is that mice that were treated with tefenoquine they got rid of their Babesia microti, I believe they were studying. But in addition, that killing of the germ resulted in permanent immunity in the mice against getting further Babesia microti. I believe it was the microti strain that they were studying, looking at. Okay. There are good case studies showing that people have recovered beautifully from Babesia microti that was not responding to standard treatments that we might use for microti. Okay. And so because of that, then many of us that use it to treat treatment-resistant Borrelia, including the possibility of something called Babesia odor have been, are interested in it. Okay. So it can work quite well. The thing is, we don't have studies that tell us the ideal dosing on it. The pills come, there's a brand called Arcata, and there's a separate brand. I'm blanking, but one of the brands makes a 100 milligram pill. The other brand makes a 150 milligram pill. And most of us, I've used it a lot in my practice before I stopped. We were all still trying to figure out what's the ideal way to dose it. And what I found in my practice, I was originally having people take 2 150 milligram pills, and I was using it every 2 weeks. And I got great response out of that. But for occasional people, I found it better to do it as a weekly dose. The reason we dose it so intermittently is that this drug has a long, what's called half-life. So a half-life is how much time does it take for half a drug once it's in you to get out of you. And for tefenoquine, it's 2 weeks. All right. Now, what that means, we also use this phenomenon of half-life to determine how long does it take to reach a top dose, right? So when something is every 2 weeks that half of it gets eliminated, it takes 4 half-lives of taking the medicine before you peak at a top level in your blood, all right? So you take a pill, and over 2 weeks, half of it goes away, but half of it's still in you, okay? And then at 2 weeks, you take it again, and it goes up a little higher. Another 2 weeks, you take it again. But eventually you get a dose up here that kind of just stays at the top level. All right. So because it does have this long half-life, I tried initially doing every 2 weeks. And it worked well for a lot of people. I found better results, though, doing it as weekly dosing. And I think most practitioners these days have settled on a 1 time a week dose on it. Okay. Now, when you use tefenoquine, you want to do more than just use it by itself. It seems to pair very well with atovaquone or Malarone. And Malarone is a pill that has a little bit of atovaquone and something called proquinol in it. Okay. It also pairs well with azithromycin. So for very complex Babesia treatments, you might start with a tefenoquine Once you're stable on that, add in azithromycin. Once you're stable on that, add in atovaquone. Okay. All right. You can also, if you have a hard time getting it, because for a long time, many of us have had a hard time getting it, you can substitute in another medicine called primaquine, which is in the same family. All right. So yeah, it could be effective. I was tending to save it for my practice for when other drugs were not working. There has tended to be a shortage of that medicine. So I was tending to reserve it more for cases and people that I had no other options in. Okay. All right. Let me just do a quick screen share where I kind of lay out these quinoline-based treatments for you. Okay. All right. So take a look at go to my infection treatment plan section here. Look at my Babesia article, which is here, Kills Babesia, a Brief Guide. And I walk you through the different steps you want to take in killing Babesia. But there are two general groups of treatments. I call one atovaquone-based treatments, which involves, the chemical called atovaquone. Then the other major group of the best treatments are what are called quinoline-based treatments. And of the quinolines, there's primaquine and tafenoquine, all right? And in here, I describe how you would work with either primaquine or you would work with tafenoquine, all right? Anyhow, that should give you some ideas. And then in here, I also talk about cryptolepis, I talk about artemisinin, and I talk about something called cryptolepis pseudocuta alcornea, also known as a CSA tincture. Okay? All right. So I do think these days tafenoquine probably is our strongest medicine. It still can be a little tricky getting your hands on it sometimes, though. Okay? All right. Good luck, Mindy. Hello, Teresa. I understand that retesting for tick-borne disease is not really useful. Is there a reason to retest ever? Good. I don't think there is. So to answer your question, no, I don't think there is a good reason to retest. So when we're testing for tick-borne infections, there's a number of ways you can test. Okay, number one, you can do tests that look to see, are you having antibody reactions, all right? And the antibody tests are called ELISAs. There's also called Western blot, and there's immunoblot. All right. The other immune system-based test is something called an ELISpot test, which looks to see, do your T white blood cells, have they reacted? Have they tried to attack the germ before? All right. So you got antibody tests, you got white blood cell attacking the germ test. All right. All right. The antibodies, once you make them, they may remain positive forever, even when the germ is gone. Right? And studies tell us that even when the germ is still there, they'll come and go. All right. So in other words, retesting to see if the antibodies are gone is some clue that the infection is out of you. It's not valid because antibodies come and go. So the other thing is a negative antibody test could be negative because your immune system is so suppressed from your germs that it can't make antibodies. So a negative test after a positive may be because your germs are so active and they're partying on that they basically have made it so the immune system can't react. All right. So a negative test doesn't tell you the germ is gone. And I can make the same argument with the ELISpot T cell test. If it was positive, then you test it again, it's negative. It could be negative, maybe because the germ is gone, but it could be negative just because your germs are partying on and they've made it so the immune system can't make those T cells. All right. So there's no point in redoing those. All right. Then the other big group of tests that we have now are called PCR tests. These are tests that look to see, do you have the genetic material of the germ in you? All right. And if it comes back positive, and these are either called FISH test, which is a microscope exam using PCR that we can look and see if you have the germ under the microscope. They're also a standard blood test that says, through a PCR reaction, can we measure the DNA of the germ? And then more recently, IGeneX has come up with a PCR enhanced culture, or they call it the EC-PCR, I believe. But anyhow, all of these are basically trying to say, can you measure the genetic material? All right. And that sounds great. If the genetic material of the germ is in you, that infection is in you. All right. The trouble is with trying to rely on that as a test to see if you're done is these PCR tests may have what is known as low sensitivity, meaning there's a lot of time the infections can be in you that they'll still be negative. And the reason is when we draw the blood, when you draw the blood, the germs are not always swimming by the needle when you draw the blood, right? Borrelia doesn't live a lot in the blood. It lives in tissues. Same with Bartonella, all right? So because these tests are so insensitive, if it's negative, it just may mean you had a poor sampling where the blood was drawn. So negative doesn't mean it's there. Now, if you do find a FISH test or a PCR test of any kind that's still positive, it does mean you still have the germ in you. But again, if it's negative, it doesn't help you at all. You can't say you're done with the treatment, okay? So that's my quick reason of why I don't believe in retesting makes any sense at all, okay? All right. Thanks, Teresa. Hi, Lauren. Let's see. He's on binder, Z binder. Okay. So if he's getting no headway, then you need to look at, is he taking the Z binder enough, or is the Z binder the right binder to be using for his mold toxicity? Okay. So if a binder is, even though in theory it might work, doesn't mean they all do. And so sometimes you even need to change up the binders. And you need, if you're not making any headway, you want to move from 1 time a day, possibly up to 2 or even 3 times a day if you can. Okay. All right. Good luck, Lauren. Hello, Mary. Is it okay to take 2 Thorn melatonin 3 milligrams to help with sleep? Yeah. I have no problem people doing that. Sometimes, a standard sleep dose is going to be 3 milligrams, but sometimes people need 6 milligrams. There's even some of my colleagues that will use it up to 15, 20 milligrams a day. So I don't advocate that. But yeah, you can go up to 6 milligrams. I don't find a problem with that. Okay. All right. Good luck, Mary. All right, let's see here. Hello, Cami. Let's see. I got bit in 2012 by tick and never tested or treated. I ended up getting C. difficile from a pulled tooth and got infected and put on antibiotics for 4 months. Then got C. difficile and then COVID a month later. Then again 5 months later, and then again 6 months later. All this activated Lyme, Babesia, Toxoplasmosis gondii, Myomati, Opselli, Epstein-Barr, etc. I also have mast cell activation syndrome and very sensitive. I also have positive nasal swab for Marcons. I have the MTHFR and COMT gene and can't get my drainage pathways open and herbs with just fish oil. Sometimes, what is the first thing I need to treat the Lyme yeast or EBV or the Babesia or the long haul COVID, and with what can I take that is gentle to get drainage pathways open and start detoxing? I do not have a gallbladder that can I take to help Herx reaction. I have autoimmune mixed connective tissue disease. Okay. Oh boy, Cami, I'm so sorry for what's happening with you. And this is too complex for me to figure out with a brief description here. I will tell you generally, I always start by treating for intestinal yeast if there's the possibility they're there. the reason I do that is if in the end, if you have to treat your tick-borne infections with antibiotics, then that may make your intestinal yeast worse. Okay. Secondly, intestinal yeast can trigger a cytokine excess syndrome. And sometimes, even though you've had horrible things with COVID and tick-borne infections, there is the rare situation where too many yeast in the intestines is the main thing triggering all your cytokines, and clearing them out can make a big difference. Okay. So generally that's where I'm going to start. However, what I'm going to tell you is you have so many complex things going on here that I cannot do you justice in this kind of a forum to tell you what's the best thing to do. I don't know where you live, and I know this can sometimes be hard to do, but you need to find a good Lyme literate medical doctor, an LMD, who can help sort this through for you and determine what's the best place to go. I can't do it in this kind of a setting, okay, unfortunately. You may be aware that you can look at ilads.org on their website, their contact section. You can actually write to them to say, I'm looking for doctors in my area, and see if they might help you locate somebody. I know there's a wide variance in the way that we all practice, but you need somebody to help you sort through this, actually. Okay. All right. Good luck to you. Hello, Jenna. Can you share anything you know about Lyme disease relationship with B cell cancers? I don't know that off the top of my head. You may be familiar with a physician named Neil Spector. It's Spector. He's a medical doctor that I believe was out of Duke University. And he got ravaged by Lyme and eventually did die from it. Okay. But one of the things that he was doing towards the end of his career before he passed away was doing research on the relationship between Lyme and cancer. And I just don't know if he was looking at B cell cancers or not. But what you might do is Google Neil Spector, excuse me, and that's Spector, and I believe it's Niel. Hold on, I'm going to just see real quick. Just a minute. So it's NeilSpector. You might Google him and Neil Spector and Lyme and cancer and see what pops up. Okay. And I even know he did some publications you might even go to what's called PubMed. That would be PUBMED.gov. That is the place where you research and see what articles people have written for research articles, okay, and see if you can find something there. But sometimes it's easier just to start with a general Google search, and they may point you to the PubMed articles as well, too. Okay, all right. Good luck with that. Yeah. Okay, everyone. This is very interesting. we're at about 7:05, and I've gone through all the questions. And as I said, yeah, we had a little bit of a lower turnout just because I didn't send out notice until this morning. Normally we have about 50 to 60 people here and about 150 people register. Okay, but tonight we had looks like about maybe 32. So that might be why we don't have a lot of extra questions here tonight. But I'm going to give everyone a few minutes to see if you have any more questions for me. And if not, I'm going to wrap it up for tonight. So if anyone is still here, feel free to ask away here. All right. Hello, Julie. Let's see. Hi, Julie. Diagnosed with Lyme 3 years ago, 2 courses of doxy and 3rd course of amoxicillin, some relief, but not normal. No further help from conventional medical route. Saw a homeopathic provider after 6 months of herbal treatment, felt back to normal. Started weaning off then. After about 4 months, symptoms have returned. Starting back on Otoba, oregano, cinnamon, clove. Oh, cat's claw too. How long should I remain on treatment after feeling better before I stop treatment? In Wisconsin and seeking a Lyme doc. Okay. So Julie, a couple things. So, one reason that people can relapse is that if they, two big reasons. Number one, they stop treatment too soon. All right. Or when they were treating, they didn't do anything to deal with what are called persisters. All right. And you may be familiar with what I'm about ready to say, but so Lyme, we think the majority of germs are in a growing state. And maybe about 10, 20% of those germs, after being treated with herbal or prescription antibiotics, will go into a hibernating state, and we call those persisters. The hibernators do not respond to standard antibiotics as well, and therefore they can lead to a relapse, basically. Okay, all right. And so when you have a treatment, you want to make sure you're doing something for persisters. This treatment you're having now of Otoba and of Otoba, cat's claw, and the cinnamon clove oregano. The cat's claw is very useful for growing and persister. Okay, there's data there. We got science that says it will go after persisters. The cinnamon clove oregano is probably even stronger at going for persisters and growing. And the cinnamon clove oregano can break apart biofilm slime layers that cover the germs and block out antibiotics. Okay. And in the Otoba, we don't really know from science whether it goes after persisters, but in combination with cat's claw, those two are great at busting up biofilm as well, too. All right. So if you do these three things, you're on a good treatment to treat persisters directly, bust up biofilm that's keeping the immune system from helping you get rid of these germs and blocking out the herbal antibiotics. Okay. And then you're also doing plenty with this treatment to deal with growing. So that's all great. Okay. So if this treatment gets you well, what I usually tell people to do is to treat for at least 2 months beyond being 100% well. And if you've relapsed once, you might even think about doing it for 4 months beyond feeling really well. Okay. So that's where I would go there. Okay. Second thing, there's some interesting, you may have seen, but last week I released an article that some people weren't happy with how I named it, but basically it's an article about your intestinal microbiome and the importance of your intestinal microbiome and keeping a good balance of bacteria in your gut, because that good bacteria regulates your brain, your immune system, your mental health system, your bones, your heart, etc. Okay. All right. And so one of the things that I found in researching that article is there is a gastroenterologist that's been doing a lot of work on what makes up the gut microbiome. And her name is Dr. Sabine Hazan. And she has shown that people with Borrelia, Lyme infection, chronic Lyme infection, have low levels of a healthy bacteria in their intestines called bifidobacterium. All right. So bifidobacterium is a very important bacteria that makes up your intestines. It regulates the immune system. It promotes the growth of other good bacteria in your intestines, et cetera, et cetera. All right. Now, what we cannot tell from her study was, did Lyme cause the low bifidobacterium levels, or did the antibiotics cause low bifidobacterium levels? And she even wonders if maybe people get Lyme disease because they already have low bifidobacterium levels that make it easier for Lyme to get in there. Okay. Now, I will let you know that's a lot of speculation. Okay. But one of the things I'm really encouraging people to do when they're done with treatment, as part of what they do when they are getting ready, or actually while they're treating, and also at the end, is rehab your gut. Okay. All right. And so some basic things that you ought to look at doing. One, if you don't have any intestinal symptoms, at a minimum, you should be taking a spore-forming probiotic. Spore-forming probiotics come from soil. They don't implant in us, but they send out a lot of chemicals that direct a healthy intestine microbiome. Okay. All right. Secondly, there's some foods that you need to be on. You need to be on foods that are rich in polyphenols and rich in plant-based fibers. All right. So fibers, which are saccharide sugars, feed good bacteria in your intestines. Polyphenols, which are chemicals that come from very colorful fruits and vegetables, and your beans, legumes, and grains. Anything that's very colorful has polyphenols in it, and those polyphenols also help your healthy intestinal microbiota. Okay, so either be on primarily a plant-based diet with animal protein or plant protein sources, but if you can't do high fiber polyphenol type diet, then supplement. And you can do a prebiotic made up of those fibers. And what I like using for a prebiotic is something called Mega Pre, and that would be 1 pill twice a day. And then polyphenol, you can get a polyphenol supplement. And there's something I now carry called Polyphenol Booster that gives you that polyphenol. Okay. All right. So at a minimum, you need to be on a probiotic and getting polyphenols and good plant-based fibers either in your diet or through supplementation while you're on your herbal antibiotics, and then continue those for another 6 months or beyond after you're done. And there now is something called a postbiotic. And what a postbiotic is basically there's a company out in the Portland area called Thana that is collecting stools from healthy donors. And they're using an autoclave, high heat, to kill any germs in those stools. And then they're processing out the dead matter and keeping basically all the chemicals that are involved in healthy intestines that directs your brain, directs your immune system, and directs your gut to be good. And sometimes I'm recommending if you can get your hands on that thanabiotic at the end of treatment for 4 to 6 months while you're doing your probiotic and while you're doing your polyphenols and you're doing your good fibers, to also be on a postbiotic. All right. So it's a lot of stuff I just said. Let me show you do a screen share here in case you're not aware of that article. All right, so this is the article. It's called Good Shit, Your Guide to a Healthy Intestinal Microbiome, Even on Antibiotics. I apologize if the good shit offends some of you, but I didn't mean it as a cuss word. I was really just saying it's good stuff. Okay. Anyhow, look through this article, and down here at the bottom is a section that I talk about what to do at the end of treatment. You'll read it. It's a long article, but it gives you a lot of good background to encourage you on what to do. Okay. All right. Yeah, evidently that title, I had a number of people that wrote me some very interesting emails about that title, but I didn't mean it as a cuss word. I meant it as good poop or good shit, basically. So anyhow, there you go. Good luck to you. Let's see. Cami, let's see. Is there a Lyme doctor you recommend? I am in Idaho. So you're in trouble in Idaho. There isn't anyone that is treating in Idaho that I am aware of. Your closest bet would be up in northern Montana, I think more in the Whitefish area, if I'm correct, but depends on where you are in Idaho, right? So if you're in northern Idaho, getting to Whitefish might be a good idea. If you are in southern Idaho, you're going to be left primarily looking at Lyme doctors either in the Seattle area, or there is a Lyme doctor in Corvallis. All right. So in Oregon, so you would have to travel. Okay. But I just don't know of anyone in Idaho that's doing this. All right. The doctor in Whitefish is a naturopathic doctor named Julie Barter. In Seattle, you might even look at seeing my colleague in my practice. She's a naturopathic doctor named Dr. Kim Iller. And in Corvallis, there is, bear with me, I have to do a quick search here. I'm just blanking. Hold on a minute. Her name is Usha Honeyman. That's Honeyman. All right. Good luck to you. Hello, Teresa says, any thoughts on taking Baluchi? Yeah. So Baluchi is made up of lumber kinase, and lumber kinase is a group of enzymes that come from the skin of earthworms. It's a crazy illness, the things we have to do to help people. So we're using earthworm extract, basically. All right. So lumber kinase is a good enzyme that does a number of things in tick-borne infections. Number one, it can help break apart biofilm. Remember, I talked about that earlier as being one of the barriers that might make it difficult to get rid of the germ. All right. And specifically what it does on biofilm is biofilms are a slime layer that's held together in a protein skeleton. And the protein that makes up the skeleton in a biofilm is made up of a blood clotting protein called fibrin, basically. All right. And lumber kinase breaks that fibrin down. All right. The other thing that we use lumber kinase for in tick-borne infections is in Babesia odicoli and also in Bartonella. There's the ability of the germs to wrap themselves in your blood clotting protein, separate from being part of a biofilm, but literally wrap themselves in the blood clotting protein and setting up what are called fibrin nests. And those fibrin nests attach themselves along with the germ to your blood vessel walls, and it makes it hard for your antibiotics and your immune system to get in there and attack. And the lumber kinase can break that apart too. Okay. So there are two major manufacturers of lumber kinase in North America. One is Canada RNA that makes a product called Baluchi. There's also Allergy Research, who right now is out of stock. And so the only one available right now is the Baluchi. But either one of these companies do a good job. The products are good products. The Baluchi is a 20 milligram pill. The Allergy Research product is a 16 milligram pill, but they are interchangeable. I don't find an effectiveness difference even because of the milligram strength difference, okay? When you take your Baluchi or your Allergy Research lumber kinase, the best way to take it is to work up to one pill twice a day. If you can't fit that in, then I recommend people take it as 2 pills 1 time a day. There are some timing issues because it's an enzyme. If you do not, so in terms of timing, then you would want to take it on an empty stomach, which means no food or supplements or medicines beginning 1 hour before you take it through 1 hour after you take it. You can have water during that time though, okay? And you can't take it with other supplements because basically it's an enzyme. It's going to eat those up and not get absorbed to work on your fiber nest or your biofilms, okay? All right. Good luck to you. Oh, be aware when you start it, you can get a herx, okay? All right. Good luck to you. Hello, Georgia. Let's see. I was treated for chronic Lyme and was doing well. Have had COVID 3 times. Since last COVID, have not really recovered. I also moved from Michigan to South Carolina. I have lots of sinus pressure, congestion, and humidity triggers vertigo. Could this be mold toxicity? Is the treatment the binders? All right. So one thing I would suggest looking at, I'm going to answer your question, but I'm going to tell you to think about something else too. So, you know, it could be that you're having just a lot of allergies because you're in a new pollen environment of South Carolina. It's not the same pollens you were exposed to in Michigan. It's a different world altogether. Those two places are different worlds in terms of the plant environment, okay? So you may just be having a lot of nasal congestion from allergies. That may be it, okay? But when you get a lot of nasal congestion and sinus pressure, and if your health has really not been doing well, you have to wonder about, I have to wonder about as a physician, is this more than allergies? Is it possible you also have a bacteria sinus infection of your sinuses, all right? And bacteria sinus infections can trigger a heck of a lot of cytokines and make you feel just as bad as activation of Lyme or as mold toxicity. The only way to know if it's a bacterial sinus infection ultimately is to get see a physician. They would order a CAT scan of your sinuses, which can give a lot of information as to whether it's more of an allergic type look to it or it's an infectious type look to it. Okay, so keep that in mind. Chronic sinus infection or even acute sinus infection, bacteria infection from just the common bacteria that are out there can make you really sick and tired and fatigued and make it look like Lyme. So if I've ever got somebody who's developed a lot of sinus symptoms, I'm going to start looking to see is an infection in the sinuses as well, too, from something that is not tick-borne related. Okay. All right. So I just want to throw that out for you. Usually, so it could be, and keep in mind, you could be having allergic reaction to mold environment in your environment, which is different than having toxins get trapped in you from breathing in the mold toxins, okay? So typically, mold toxins do not lead to bacterial sinus infection, all right? Now, I know that there are some of my colleagues that when people have mold toxicity will also do a nasal swab to see if you have an infection in your nose passages called methicillin-resistant coagulase negative staph, also called MARCoNS, all right? And MARCoNS is a staph bacteria that colonizes, lives in your sinus passages, that does not cause a direct infection that gives you drainage of your sinuses, okay? MARCoNS is an idea that a physician named Richie Shoemaker came up with, and he was looking for a reason why when people did not get better after he removed their mold toxins, and he's been hunting for a reason for that ever since. And one of the ideas he fell upon is maybe it's because they're colonized with MARCoNS. Most of us don't follow that anymore. And there are still some doctors out there that will test, but most of us have discovered that even if you try to eradicate it, it always comes back. And I've come to the belief, and I think the majority of doctors are now of the belief, that MARCoNS is just a bacteria that lives there and doesn't cause anyone trouble. All right. So that's not your cause of it either. Okay. All right. Good luck to you, Georgia. Hello, Mary. Let's see. I have HLA-DR4 gene. It seems to affect my ability to make B-cell antibodies. My ELISpot tests are positive for Borrelia miyamotoi, Borrelia burgdorferi, and Bartonella henselae. But when tested at IGeneX, my test came out negative except for band 30. Still sick after a year of using herbal antibiotics. The herbals reduce the symptoms but don't eliminate the infections. Would using a higher dose than 30 drops twice a day help to eliminate the diseases? So you raise a good question. So, when we're using herbal or prescription antibiotics in somebody, people will do best if, in addition to the herbal or prescription antibiotic killing germs, if their immune system can step in and help as well too. All right. And so you have part of your immune system isn't working well, right? So you're missing some of these antibodies. We're missing some help from the immune system. So you can make an argument, and I have done this in my practice before, is to use higher doses of the herbal antibiotics. So yes, you could even double the dose at the standard doses up. So from 30 to 60 drops twice a day, and see if that makes a difference for you. Okay. All right. Good luck to you, Mary. You're welcome, Julie. Thanks for saying thank you. Hello, Bob. Let's see. Just want to say thank you kindly hosting this webinar and tactfully responding to difficult questions. I can honestly say it is helpful, and I bring much of this back to my providers for discussion and help. By the way, most of my providers know who you are and respect your insights and advice. Great. Thanks for sharing that, Bob. I appreciate that. Cami, so you're in Idaho Falls. Yeah. I got to tell you, I think your closest bet is even in Idaho Falls. I think you're going to be closer getting up to Whitefish, Montana, than you are getting over to Seattle or to the Portland area. Corvallis area. Yeah. Good luck to you. Hello, Daria. Let's see. I have Lyme with Babesia, Borrelia, Epstein-Barr, mold, and long haul COVID, 3 of 4 infected. How on earth do I know what infections are doing what? I have severe respiratory, heart, and brain inflammation in Canada. Wow, that's a tough one. I got to tell you, there's not a canned answer that I have on that. These are people, if I was treating people in similar situations to you, and I would just have to sit down, take a careful history, and see if I could get some insights from the history about what happened when, okay, unfortunately. You may want to take a look at my article on how to, if you go to my Lyme information site, type in long COVID, I have a whole protocol. It's very complicated because long COVID is complicated, but a lot of the things that you would deal with that address long COVID are going to help you in terms of if there is activated Babesia and Borrelia, et cetera. Okay. And ultimately, what you need is a good doctor who can sit down and help you sort through this. And obviously, I can't do this here. If you are living in Canada's tough because they're just your medical system up there has prosecuted doctors for treating this. So you have a few people that are doing it. You may even want to look across the border, and I know you're probably too sick to travel, or you may be, but you may need to get some help on the U.S. side by integrative medicine doctors that are treating all of these chronic conditions. Okay? All right. Good luck to you. Let's see here. Bob, let's see, Bob. Is monolaurin an effective biofilm buster? I don't know. I've never used it for that. I think there's other agents that work better, and so I don't necessarily use that. Yeah, good luck. I think Bob and Margaret, you guys are working in tandem. Let's see. What do you consider the best biofilm buster? Yeah. So there's a number of things you can use. Okay. So you can use biocidin, which can kill germs, also is a very effective biofilm buster. The combination for Borrelia, the combination of cat's claw and Otoba is a very effective biofilm buster. Lumber kinase can be a biofilm buster. But I think my favorite biofilm buster these days is a newer product that has come out by Research Nutritionals called BioDisrupt. And the reason I like it is addressing biofilms from a number of angles. It's got enzymes in it to help break down the proteins. It's got chemicals in it that keep the biofilms from talking together. It keeps the biofilms from being sticky enough to attach to surfaces. There's many levels at which it works. In addition, Research Nutritionals has done a research on their product showing at least on the Borrelia side, it has some really good activity. Okay. And knowing of how it worked on the Borrelia side, I suspect it's going to be quite effective or is quite effective against Bartonella as well too. All right. So it's called BioDisrupt. You can find it at my supplement store. I believe it's 2 pills twice a day. See, when you look at there's a tab you can click on that's about ingredients. In there, I have the recommended way, the directions on how to take it that I suggest. Okay. So BioDisrupt by Research Nutritionals, that's BioDisrupt, all as one word. Okay. All right. Good luck to you, Margaret. Hello, C. Thank you, Dr. Ross, for sharing your expertise. Do you have any thoughts on the efficacy of limbic vagal system retraining like DNRS or Gupta or Primal Trust programs? Do you prefer one over the others? So I think I love the vasovagal retraining systems. There's a point at which when you have chronic infection, it can result in a hyperactivity of the limbic system and the vagus nerve system. Okay. And all of these symptoms, the anti-hopper, the Gupta, and the Primal Trust programs are working with methods that help you to be less reactive and will therefore calm down the vagal nerve and how it interacts with every organ in your body. Keep in mind, the vagus nerve, there was actually a workshop 2 weeks ago in Vegas, and one of the there are a number of presentations on the vagal nerve. It feeds practically every organ in the body. So if it is overstimulated and overreactive, it's going to affect every organ in the body and could be a reason that people hold a lot of chronic symptoms, even if their germs are gone. All right. So of these training systems, I think you have to find the one that's your preference. The DNRS by Annie Hopper is a lot more rule driven and Army boot camp like, okay? Gupta is very much a Buddhist kind of more mindful approach. And from what I understand, the primal trust is even a little easier to do and probably even less boot campish than even Gupta. But I think you just have to see, go read their stuff, see which one resonates with you. Because there are some people that love Annie Hopper's stuff. There are some people that love Gupta. There are some people that love the primal trust. You just have to see which one resonates best with you as you're reading about it, which one fits you, who you are best. Okay. All right. Good luck. Thanks for that question. All right, everyone. I think that's it. Thank you for the questions that got us to the end here. I've had a good time being with you, and I'm glad that many of you got a chance to ask questions that maybe you wouldn't have gotten to if we had more people here. As I said, I created a recording of this, and if all went well, we'll find out here in a few minutes. If the recording worked, I will be glad to share that with you tomorrow. I've got to spend some time this evening editing it and creating a summary. So somewhere around 9 to 9:30 a.m. Central Standard Time, Austin, Texas time tomorrow morning, look for an email from me. Okay. And if you get benefit here, a lot of other people will too. So if you happen to know people that are struggling with this crazy illness, feel free to share and send my emails on to them as well too. Okay. And then Jean just said, God bless. And then she said, shit is a fine word. I appreciate that, Jean. Thank you. So everyone, one last thing. Many of you may know, but I have a whole online membership support group that I'm running if you like what I'm doing here, my online support group called Lyme United is like this forum on steroids. Okay. You get to interact with me daily there. There's an office hours with Marty Ross MD where you can write questions to me daily and I respond. Once a week, we have a live webinar in a Zoom room where you can ask me questions and I get to interact with you. We have forums there where you can interact with other members. It's a really active community. We're up to about 80 people right now, and I'm always looking for more people. The way to find out about it is go to treatlyme.net and click on the Lyme United page and see if it resonates with you. I welcome you if you want to come join us there as well too. All right. All right. Good night, everyone. I'll see you next week.